Hi, welcome to Coronavirus 2019, What You Need to Know. This session is being facilitated by Yvette Wood and Olga Hall with Volunteers of America. Olga, you may begin.
Thank you. Next, what is coronavirus? Coronaviruses are a large family of viruses that are known to cause illness ranging from the common cold to more severe diseases such as severe acute respiratory syndrome and Middle East respiratory syndrome. Coronavirus, or COVID-19, is a new strain of coronavirus that has not been previously identified in humans. The COVID-19 is the cause of an outbreak of a respiratory illness first detected in Wuhan, Hubei province, China. Next. How is coronavirus transmitted? Currently, it's believed that the coronavirus spreads from person to person between people who are in close contact with each other, about 6 feet away from each other. It's thought to be transmitted via respiratory droplets produced when an affected person sneezes or coughs, like other respiratory viruses. Symptoms may appear anywhere from 2 to 14 days after someone is exposed. Next. Coronavirus signs and symptoms. Common coronaviruses can cause symptoms similar to a common cold, like fever, cough, sore throat, and feeling unwell. The symptoms that are currently being seen with the current coronavirus infection are fever and respiratory symptoms such as cough and shortness of breath. The coronaviruses can also cause more severe symptoms such as high fever, cough, and respiratory distress that can progress to pneumonia and be fatal. Next. The following symptoms might appear 2 to 14 days after exposure: fever, cough, and shortness of breath. You should call your doctor if you develop any symptoms and or you've been in close contact with a person known to have coronavirus, or if you've recently traveled from an area with a widespread or ongoing community spread of the coronavirus. Next. Am I at risk? There have been several cases of community spread of COVID-19 reported in several states. Community spread means spread of an illness for which the source of infection is unknown. At this time, the virus is highly contagious, and the CDC is urging everyone to be vigilant. Those at highest risk are those with weakened immune systems, those exposed to someone who's tested positive, those that have recently traveled overseas, and those persons over the age of 60. Okay. And Yvette, I will let you take up from here.
Prevention. There is currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday actions to help prevent the spread of COVID-19, such as, next, hand washing. Wash your hands with soap and running water when hands are visibly dirty. If hands are not visibly dirty, frequently clean them by using alcohol-based hand rub or soap and water. Next, protect yourself and others from getting sick. Wash your hands after coughing or sneezing, when caring for sick, before, during, and after you prepare food, before eating, after bathroom use, when hands are visibly dirty, and after handling animal or animal waste. Next. I want to protect myself and my family. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth, especially after touching public doors, shopping carts, or etc. Stay home when you are sick. Cover your mouth when you cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using regular household cleaning spray or wipe. Next. Protecting yourself against coronavirus. You will now watch a short video on how to protect yourself against the coronavirus.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Tracking the coronavirus. The USA has 566 positive cases of coronavirus as of March 10, 2020 at 8 a.m. The state of Maryland had 6 positive cases, North Carolina 5 positive cases, Virginia 5 positive cases, Washington, D.C. 4 positive cases, with results changing every hour. Next. What next? Please be sure to maintain a healthy lifestyle. Boost your immune system with things such as vitamin C and D. If you're feeling a little overwhelmed with the anxiety over the coronavirus, limit the time you spend listening to the media and arm yourself with facts and not myths. Be sure to ask questions. The CDC is a great source for the most up-to-date information. Be sure to talk with your family and your children about coronavirus prevention. Most importantly, if you begin to feel unwell, stay home. Next. Questions and answers. One of the questions that's asked more commonly is, what does it mean by community spread? Community spread means that it's gone from one person to the next. The CDC is not really sure what the mode of transmission is outside of respiratory droplets, which you saw in the video previously. So be sure, again, to cover your mouth when you sneeze, wipe your hands with sanitizer when touching inanimate objects, and to avoid those who are coughing around you by the distance of at least 6 feet or more. Please use mask when you're in a situation where you cannot protect yourself from those who are coughing, or what we call reverse isolation. If you are coughing, you put on a mask to protect those around you. And this concludes our session on the coronavirus 2019. Thank you.